Welcome. Linda and I are delighted to join you this afternoon for a conversation about patient engagement. We congratulate all of you on your efforts to engage patients and families in your work and your plans. It's wonderful that you are benefiting from patient and family advisor groups and that you've worked to make sure that what they do is very meaningful. Certainly, your education guides will be more helpful because you've sought input from patients and families. You've tapped into the great motivational power of patient stories from patients and families, and it's helped you to uncover barriers and facilitators to implementing change. You've shown that you clearly understand that patients are the experts in their own care, in our own care. You continue to involve patients and families throughout COVID by using virtual platforms. And you've been an exception because many healthcare facilities have stopped patient-family engagement during these very challenging times. We thank you and applaud you for your efforts. Well done. Linda, I wondered, is there an example of patient engagement which stands out for you?
Yes, there is, Theresa. And just before I go into that, I just want to thank everybody for joining us today because I know it's very, very busy pandemic time for people across the country. So thank you so much for joining. So one of the most satisfying projects that I was ever engaged in as a patient was the development of the 5 questions to ask regarding your medications. It's a poster. I think quite a few of you on the line today have maybe seen it. So in the beginning, 2 patients were involved from the very beginning with a number of clinicians, and the first few drafts looked a lot like a monograph that you might get after you pick up a drug at the pharmacist. So pages and pages of information about a drug. Well, over time, the final poster with lots of patient input looked like this, and you probably have seen this around and about. So why was this so successful? And this is how successful it was. It has proven to be extremely relevant to patients and the public and providers, so much so that over 200 organizations have adopted it, and it has been translated into over 100 different languages. So why was it successful? Again, because patients were involved right from the beginning. And secondly, the clinicians who were willing to listen to the patient input. And I have to give a big shout out to Alice Watts, who I think is actually with us today on this conference, a clinical pharmacist in practice at a hospital who was in charge of this project. And she listened and listened and listened. And as well, as we got closer to our final iterations, Alice, who did work in a hospital, was able to take our examples and take it out and try it out on both patients and providers. And that was a very, very important part of this step, and something that would be absolutely possible with the improvement projects that you people are working on. So this was a success story in which patients and clinicians worked together right from the beginning and who valued each other's input. And it ended up in a very meaningful project and poster for the public and for providers. So while I have a moment, though, I would also like to briefly mention another project that I was involved in from the very beginning, and that was the development of the Canadian Quality and Patient Safety Framework for Health Services. And in this one, 2 to 3 patients were involved with about 45 clinicians from across Canada around the table to develop that framework. And again, reams and reams of paper were refined into 5 goals with objectives and outcomes. And again, patients were critical in this process from the very beginning. So just want to give a bit of a shout out on this. The framework will be rolled out this week in a webinar on Friday. So thanks, Theresa, for asking.
And did you have a question for me?
Yeah, I wondered what the evidence is that, in fact, patient engagement is important to development of improvement projects.
And there certainly is evidence building. It's been shown that patient engagement is connected to improvements in safety, like increased rates of hand hygiene, reduced infection rates, and decreased medication errors. It's also associated with an increase in the quality of healthcare services because it tends to reduce patient anxiety. It helps us to understand more about our conditions and what we're supposed to do. And it helps us then be much more able to participate in our care. The World Health Organization has shown that patient engagement can lead to savings of up to 15%. And that's because patient engagement tends to reduce rates of readmission, it reduces length of stay, and it increases staff retention and recruitment. So certainly you are all on the right track by engaging patients and families. And much of this evidence information is in the Engaging Patients in Patient Safety, a Canadian Guide, which is in your resource list. Another example of patient engagement work is being done by our partners at the Canadian Foundation for Health Improvement on their Better Together program. And they're generating resources for the reintegration of patient, families, partners in COVID times. And that resource about Better Together is also on your resource list. Linda, I wonder, is there a particular challenge in engaging patients and families you'd like to comment on?
Yeah, I want to say there's a big challenge, and we face it at Patients for Patient Safety Canada as well, and we're really working on it. And that is to increase the diversity of patients who are being asked to participate. We need to find ways and reach out to Indigenous people, to newcomers, and to others who are not normally asked to be at the tables. And I recall a conference I was at, hearing a patient advocate from a Toronto hospital talking about signs in English about wash your hands, where the majority of the patients did not read English. And you know what? We have to do better than this. Mm-hmm. And the only way we'll do better is by having representatives of those populations we serve at the planning tables. So we need to engage real patients and where they are. And this has its challenges. There's tangible challenges like payments for parking, for travel expenses, maybe for babysitting, and attention to scheduling to when these types of people will have the time to attend. And those are the easy things. The harder things are meeting the patients where they are and providing support and mentoring so that they can participate fully. As well, being sure that information is at the right level so that people can understand, and paying attention in this day and age to having virtual access, because that's about the only way any of us are going to be engaged. So a lot of challenges, but very, very important for us to pay attention to moving forward.
Great. So thank you, Linda. Great comments. So we just want to congratulate you on your efforts, encourage you to keep doing what you're doing in terms of patient engagement. So coming up next is a video made by Patients for Patient Safety Canada members and our partners. It was made for World Patient Safety Day, which was September 17th. And the theme of the video is, if healthcare workers are safe, patients and families are safe. So we applaud you and congratulate you, and enjoy the video. Thank you. Take care.